Hello and welcome to this Improvement Science Snapshot on the development of an online implementation outcome instrument repository, a resource that has been designed for healthcare professionals, quality improvement leads and applied health researchers to help them select and identify good quality measures to evaluate improvement and implementation efforts. I'm Louise Hull. I'm a Senior Research Associate within the Centre for Implementation Science at King's College London, and also Deputy Theme Lead of the Implementation Research Theme of the ARC South London. When planning a quality improvement or implementation project, it's important to be able to determine whether improvement efforts have been worthwhile and successful. This can be done by measuring a number of different outcomes. Most healthcare professionals, quality improvement leads, and applied health researchers will understand the importance of measuring the impact of improvement efforts on patient and service outcomes. However, less focus has been directed towards measuring what have been termed implementation outcomes. Measuring implementation outcomes is extremely important to understand implementation success and failure. And as such, all implementation and improvement projects should measure implementation outcomes in some form. Implementation outcomes have been defined as the effects of deliberate and purposive actions to implement new treatments, practices and services. In 2011, Proctor and colleagues proposed an implementation outcome taxonomy containing 8 core implementation outcomes: acceptability, adoption, appropriateness, costs, feasibility, fidelity, penetration, and sustainability. Implementation outcomes can be measured using a variety of methods, including qualitative, such as interviews, and quantitative methods, such as surveys. If you plan to measure implementation outcomes using quantitative methods, it is really important that the measures that you use are reliable and valid. So over the past few years, there have been numerous systematic reviews published that have identified and appraised the reliability and validity, and more recently, the pragmatic quality of quantitative implementation outcome measures. A common finding of these systematic reviews is that the number of instruments, particularly for some implementation outcomes, is limited, and the availability of psychometrically strong and robust instruments is limited. We conducted a systematic review to identify and appraise the quality of quantitative implementation outcome measures developed and validated for use in physical healthcare settings. The methodological quality of the studies included was assessed, as well as the reliability, validity, and usability of each instrument. For further details regarding how these qualities were evaluated, please read our publication. Based on the results of this systematic review, we sought to develop a free, online, user-friendly repository of implementation outcome instruments for stakeholders wishing to quantitatively measure implementation outcomes. We worked closely with Icon, a creative design company, to design and develop the repository. During the design phase, we sought feedback and recommendations for improvement from stakeholders, including applied health researchers, healthcare practitioners, and patients in the public, on the content, including depth, breadth, and complexity, the design, the look and feel of the repository, and also the usability, so the ease of navigation and identification of instruments. The repository currently contains 55 implementation outcome instruments developed and validated for use in physical healthcare settings, measuring 6 of the 8 core implementation outcomes included in Proctor's implementation outcome taxonomy. The repository has been designed to allow users to search for instruments according to implementation outcome, view a detailed summary of the instrument, examine the methodological quality assessment of the psychometric study, examine the psychometric quality and usability of each instrument, and also access resources related to each implementation outcome instrument. The repository is freely available via www.implementationoutcomerepository.org. We hope the repository will help stakeholders identify and select a methodologically and psychometrically sound, as well as usable instrument to apply in implementation and improvement projects. We'd like to thank our funders and collaborators.